Global pandemic, local stories.
The podcast Global Pandemic, Local Stories was developed from collaborative activities between professors and students of Florida International University, FIU, and São Paulo State University, Unesp. Since November 2021, Professors Dr. Ming Fan from FIU and Dr. Luciani Taneni from Unesp worked together and created a virtual learning exchange project, which took place from March to April 2022. American and Brazilian students were grouped into 5 teams and used technical tools to work together. They collected information and interviewed people who faced educational challenges throughout the first 2 years of the COVID-19 pandemic. The very good results we have achieved encourage us to share with you interesting data and great stories from the US and Brazil.
Listening to this episode, you will learn more about the following topic: stories of the resilient. Stay with us.
Adapting to a new normal. Cases of resilience in the United States and Brazil. Society has undergone a once-in-a-lifetime change that has affected the entire world. After the past 2 years of living through the COVID-19 pandemic, we can see several stories of resilience. These stories all shed some light on the question, how does one overcome this period? Hey, I'm Nadjob Nhaga, and I'm from Brazil.
Hi Nadjob, I'm Jasmine Solorzano, and I'm here talking from the United States. We are both here together to talk about cases of resilience during pandemic times. What is being resilient, you might ask?
If we put this question in Google, we find as one of the answers that resilience is the ability to adapt to difficult situations. In many cases, like in the pandemic, people has to be resilient to survive. This podcast is a collaborative multi-host project that provides viewpoints on the effect of coronavirus in the communities of Brazil and the United States. We have talked with a variety of members in each of our communities. Our podcast will include interviews from a group of women and moms that work within various fields such as teachers, healthcare professionals, and small business owners, living in different social realities in Brazil and in the United States.
We will discuss how they have dealt with tribulations like the education process of the children during the COVID-19 pandemic, or how they maintained their business to stay afloat during this time. It's important to highlight here that we'll use fictitious names to preserve the privacy of the interviewees. Another thing is to keep in mind that this podcast is conducted between students from the University of State of São Paulo, Unesp, and Florida International University, FIU, as part of an international learning program under the supervision of the professors from each university.
Let's dive in together.
As we discussed, interviews will be addressing different perspectives from both the United States and Brazil. One of the perspectives follows both an American and a Brazilian teacher who have experienced firsthand how the pandemic has impacted both students and teachers. With this, we compare and contrast the viewpoints of both teachers to see how the pandemic was being handled, not just locally, but globally. Roselino from Brazil and Jordanka from the US discussed the difficulties of distance learning and said that they have never experienced a mental challenge like the one presented during the last 2 years. Roselino said that some families had limited connection with the internet and this made teaching even more difficult. She said that despite the attempts of parents and caregivers in carrying out the activities and following the guidelines, the time dedicated to the activities was reduced during the pandemic period due to factors such as work commitments and health problems, mainly because it is a population with financial restrictions. In addition, the parents did not have the pedagogical training to stimulate and develop the required activities. Finally, she also adds that everyone, teachers, parents, and the school, did their best during this period to face the difficulties that appeared. Now, the experience of Professor Jordanka was similar. She works at Miami Lakes Educational Center in Miami, Florida, and spoke on how it was hard to keep the students engaged online as they had their cameras off and were muted the whole time. She described it as a very stressful and frustrating period because she knew it wasn't easy for the teachers or students. With the views of those within the school system, we have perspectives of parents who struggled providing the child with an at-home education while trying to provide for the household as a whole. Mothers had their workday tripled. In addition to the domestic activities and their job, many started helping the children with their school's activities, which dealt with distance learning. However, many mothers could not work at home and had to continue working outside, resorting to informal daycare centers as shown in the reportage by El País. In these cases, informal daycare was a way to overcome this period. In the article, we notice a mother who, after being dismissed, decides to start an informal daycare center as a way to earn income and still be with her daughter. In other cases, many mothers stopped working because they had no one to take care of their children, as seen in Rosa's case. She is a Brazilian mother of a 6-year-old kid who studies in a public school and who attends a public daycare. With 4 people in the house, the child was assisted most of the time by her family. To help her family's income and to be with her daughter, she started making sweets at home to sell. What is your input on this, Nadjob? What's another perspective you think we should focus on?
Well, I wanted to state that your viewpoint on the school system remind me of another area that is heavily affected by the pandemic, and tested their emotional and physical state. It is not only those in the school system who were affected by the pandemic, but also those in the healthcare industry. In an interview with Lerica Fonte, the head pharmacist of a small business in the U.S., she said the employees were scared to get near a patient who was sick after the spread of COVID. And as the boss, she could not be afraid during these troubling times. She had to stay resilient. Fonte took charge and made some changes to her business. She had all her employees and customers wear facial coverings, regularly sanitizing their hands, and use a touch-free form of payment. She installed a plexiglass between the front counter and the patient line, limiting particles that could transfer from employee to customer, or vice versa. All of these changes helped the better environment and mood amid the pandemic. And speaking of being resilient, Alex, a healthcare professional in the U.S., described the resurgence of the pandemic as the hardest thing she ever done in her career. When discussing the pressures of caring for patients in critical conditions, she described it as the worst feeling ever. The pandemic has been extremely stressful for healthcare professionals both physically and psychologically.
Thank you for bringing up the topic of undergoing such a stressful time. This pandemic took a toll on a lot of people. Everyone's mental health was affected. Norema, a 70-year-old woman who has lived through the very terrifying experience of finding out she has a chronic disease during COVID-19 pandemic. She felt how it was very difficult to live in a world of unknowns, and that some days it is incredibly difficult and stressful knowing about her disease in such hard times. But she has decided to take one day at a time and persevere through it all.
These real stories allow us to see how resilience was essential for this period. The pandemic changed the way people lived and worked. The way everything was changed at the beginning of the pandemic meant that people had to adapt to isolation and many other challenges, something never before faced by our generation.
I agree, Nadjob. I don't think anyone was prepared to undergo such a challenging moment that took the world by storm. So the resilience of these professionals is remarkable. I would say inspirational even, in all kinds of work, from teaching to healthcare. While we continue to try and adapt to this new society, these stories show how being resilient does not have one definition, but can be shaped into a plethora of examples. Resilience was very noticeable in the interviewees. They're all Wonder Woman. Do you agree?
Yeah, but these hard times, we realize that everyone needs to take care of their mental health while trying to evolve in a world that is ever changing. We hope this lets you consider how we've been resilient during this time period or how we could be going forward.
And this was our podcast. Thank you for listening, and thank you, Nadjob, for co-hosting with me.
No, thank you for having me, and it was a pleasure to collaborate with you. Bye, everyone.
Bye.
We are grateful for the contributions of the interviewees, the technical support of Romulo Borim, Laboratory of Phonetics at Unesp, and the academic support of Stephanie Dotcher at FIU, the coordinator of the Collaborative Online International Learning COIL, and Ana Cristina Solomon at Unesp, the coordinator of the Brazilian Virtual Exchange, Bravi. Give us your feedback, sending emails to mingfang@mifang@fiu.edu.
And Luciane Tenani at luciane.tenani@unesp.br. Thanks for listening.
Global pandemic, local stories.